she fell and hit her head when she had the heart attack. And most people who have heart attacks do so when they're trying to poop, which is a terrible way to go. But the number one reason for heart attacks in old people is trying to go to the bathroom, because you hold your breath. That increases pressure in your chest cavity, which causes a transient increase in blood pressure. This female cadaver is 59 years old. We take off a layer here. Whoa, not all the layers. Just take off some here. Okay. You can see that she has fairly decent muscles. And again, you can click on the muscles and it tells you what they are. Table's pretty touchy tonight. There's the sartorius muscle, for example. It kind of goes across from the lateral to the medial side of your hip to the medial side of your knee. If I color that white there or yellow, you can see it a little bit better. But when you take away that muscle,
sartorius muscle,
you can see the quads. Remember, the quads are on the front and the hamstrings are on the back. So
rectus
that is the rectus femoris muscle, kind of the one in the middle. Vastus lateralis on the outside in red, and vastus medialis in blue on the medial side. And then the vastus intermedius is on the inside. That what makes up number 4 to make up the quads. So there's a little bit, some basic muscles. Her abdomen, you can see there's a lot of tendon. This muscle out here is the external oblique. Okay, but we're going to take now another layer of her, and now what you see is the internal oblique. The oblique muscles, there's the external, internal, and transverse abdominis. They each go a different direction, the fibers do, but they can be very thin layers of muscle. Anyway, they go from outside to inside, or superficial to deep, external oblique, internal oblique, transverse abdominis. But what you're looking at now is the deeper muscles. You can see pectoralis minor, for example, because pectoralis major has been removed. So if we keep going down and we take down another layer, pretty soon the muscles are pretty much gone. So we have removed all the muscles at this point, and we're down to the gut organs. You can see that there's quite a bit of fat over her gut organs. That's completely normal. It kind of keeps them all in place, which is good because we don't have bones there to protect us. But we couldn't have bones in our abdomen. We wouldn't be able to bend. So it's a good thing that we have this fat there.
Mesentery.
Okay, called the mesentery, and I'm going to remove that. Okay, so now you can see her digestive system pretty well. The largest internal organ is the liver. If I color that blue, you can see how big it is. It is usually more on the right side than the left, but hers is pushed over even onto the left. So she's got a huge kidney. Okay, I'm going to blow this up a little bit even more for you. Or sorry, a huge liver, not kidney. Okay. All right, so that's her liver, and I am going to remove that so we can see the digestive system a little bit better, but also her respiratory system. And you can see her rib cage. You guys all know the bones because you've done that, right? One thing interesting is if I highlight her sternum and make it blue, look at the end of it, the xiphoid process where the diaphragm is attached. Instead of having one projection, it's called a bifurcated sternum. It looks like a fork, or there's 2 tines there. The dark blue, there's a thinner one down on her left side. Anyway, probably didn't affect her too much, and maybe they didn't even know until they dissected her, but usually there's just one projection there, and she's got 2. Okay, so I am going to take away her rib cage. And yeah, I'm going to take away her rib cage just so we can see her respiratory system a little bit better. Okay. Oh, you know what? I better take away her ligaments as well.
Costal cartilage.
There we go. Okay, so now you can see her two lungs with the heart beating in the middle. She's got really good, nice, healthy red lungs, totally normal. And the respiratory system, of course, includes from the mouth down or the nose down to the lungs. So the right lung, okay, is bigger than the left because the heart, notice, is pushed over to the left. It's not central. So the right lung is bigger than the left lung. Okay, and I suppose I could color those so you guys could see them a little bit better. Okay, here's the left lung and the right lung. Okay, so you can see nice, big, healthy lungs. Her trachea. Let's color that green. Okay, the trachea brings air to the lungs. And the trachea comes down from the voice box down to the lungs and splits into the right and left primary bronchi. And I don't know if we can see that. We might have to take away the aorta. So the right bronchi, I just colored it red, but
Primary bronchus.
And let's color the other one red. Let's take away some of the heart. Cardiovascular system. Let's take away the heart. The arteries of the head and neck. I don't want to take away the arteries and veins of the thorax because I want you to be able to see. Let's do that. Let's stop it beating. There we go. Okay, can you see the trachea, the green trachea, and how it's divided into the right and left bronchi? I don't know if you can see that. Let's take away one of the lungs.
Tertiary bronchi.
And these are tertiary bronchi. And up
Intercostal
above
arteries.
that are secondary
Internal
bronchi.
thoracic artery. Intercostal
See if
vein.
I can
Primary
get that to highlight. There we go. I think that's supposed to be red. Make it blue so you can see it better.
Secondary bronchi. Secondary bronchi.
Secondary bronchi we will make purple. Okay, so the trachea comes down.
Brachiocephalic vein.
And
internal
divides into the primary bronchi and one for each lung. And then it branches into secondary bronchi, one for each lobe. There are 3 lobes in the right lung and 2 lobes in the left. Because again, the left lung is smaller. And then it branches further into tertiary bronchi, and that's these green things here, and they branch even further into bronchioles, which are tubes lined with simple cuboidal epithelial tissue, and then they lead to the alveolar ducts to the alveolar sacs. And you can't see those because those are microscopic. But the only place where air is exchanged is the alveoli. Okay, you have air in the trachea, air in the primary bronchi, air in the secondary bronchi, air in the tertiary bronchi. But until the air gets all the way down to the alveoli, you can't exchange any carbon dioxide and oxygen. And remember, oxygen is diffusing into the blood, and CO2 is diffusing out of the blood to and from the alveoli. All right, going up the respiratory tract, the trachea here in green technically starts at the voice box. So this is the voice box, but around the voice box is cartilage, thyroid and cricoid cartilage. This thickens as you get older if you're a male, Okay, and that's why men have, or later in teenage years, they start to develop an Adam's apple and their voices are deeper because it's harder for them to constrict their voice box, which makes it harder to make a higher pitched sound. So men generally have a deeper voice. Anyway, that cartilage is wrapped around the voice box. The fancy word for voice box is, of course, larynx. Above the larynx, that's your throat. That would be called the pharynx. And in the digestive system, the oropharynx carries food. In the respiratory system, the oropharynx also can be part of the respiratory system carrying air. So it's kind of goes on for both body systems. So if I turn this person, or if I cut this person in half and turn her sideways, okay,
Trachea.
there's the trachea, okay, that's the inside of the trachea.
Pharyngeal cavity.
This is the pharyngeal cavity. In other words, the throat, okay? So the pharynx goes up into the mouth and further up into the nose. And so it can be divided into the region behind the nose here is the nasopharynx, where the tonsils are located back there. The part behind the mouth is the oropharynx, and the part down here in the where the voice box is the laryngopharynx. So if you were a molecule of CO2 leaving the lungs, you would be in the alveoli, the alveolar ducts, the bronchioles, the tertiary, secondary, primary bronchi, trachea, go through the larynx. You're in the laryngopharynx, the oropharynx, the nasopharynx. Okay, you're up here in the nasal cavity, and those blue things are the sinuses, the nasal cavity. Here is your nose, and so the air would leave via the nose. You're supposed to breathe through your nose, so a molecule of oxygen comes into the nasal cavity. The ciliated epithelial tissue there warms, humidifies, and cleans the air much better than your mouth does, which is why they say you should breathe through your nose. But of course, a whole bunch of us who are stuffed up because of all the pollen and all the plants right now are going to breathe through their nose. Anyway, the nasal cavity, and then follow it back down. If you were a molecule of oxygen, you'd want to go nasal cavity, nasopharynx, oropharynx, laryngopharynx, the larynx,
thyroid cartilage,
the trachea, primary bronchi, secondary bronchi, tertiary bronchi, bronchioles, alveoli, to the blood. The first question on the lab test for the respiratory system is trace the pathway of oxygen or CO2, depending on which question you get. Tell me the anatomical structures that that molecule is traveling through. And you can easily get 8 or 10 structures if you name them all. Don't just tell me it goes to the lungs. Of course it goes to the lungs. That's where air goes. So basically that's the respiratory tract. In general, the parts above the voice box or larynx is called the upper respiratory tract, which we clear by sneezing, and or the parts below where the air goes, below the larynx, is lower respiratory tract, which we clear by coughing. Although if you get crud all the way to your alveoli, if fine particles of dust get that far, no amount of coughing is going to get it out. You got to hope your white blood cells are working at that point, because once you get to the alveoli, coughing is not going to help. Okay, so that in general is the respiratory system. Let's put her back together. Okay, and we will take her down again. Okay, put her digestive system there. Take a little bit more out of the digestive system, not that much. When you take the digestive system away, you can see the urinary system. So you can see her two kidneys here. There is the left kidney and the right kidney. You're supposed to have 2 kidneys, and I had a student once who had one and didn't even know it until he was 13. He was in an accident. He fell off his bike or got hit by a car or something with the bike, and they did some sort of scan or X-ray or CT to see if he was okay and found he only had one kidney. So you can live on one kidney. You can donate a kidney, but you're supposed to have two. They are located behind or retroperitoneal, which means behind the peritoneum. The peritoneum, remember, is the cavity that contains all your digestive organs. Okay, so the kidneys have a tube that comes out of them that
Ureter.
leads to the bladder, and it's called the
Superior epigastric artery.
ureter. See if I
Superior
can hit it on
epigastric
that
vein.
side.
Kidney,
Yeah.
jejunal, and ileal veins. Ureter.
There we go. Okay, so there's the ureter. Goes down to
Broad
the
ligament. Urinary bladder.
bladder. We'll make the bladder bright yellow there. Okay, so the ureter moves urine down to the bladder. It moves, the fluid moves by peristalsis, which means even if you're standing on your head, urine would still move from your kidney to your bladder. Okay, it moves by peristalsis. It's not gravity, and it just doesn't just run down there. I'm sure gravity does help, but it doesn't matter. You don't need that to make urine move. The ureter is tube, so of course it's lined with epithelial tissue, and it's specialized. It can handle acid because urine, on average, is acidic. The normal range is 4 to 8 for the pH, but remember, 7 is neutral, so most of the time urine is acidic. And actually, that's kind of a good thing. Because it burns up any bacteria or other stuff that might be coming up your urethra. Now, the urethra is the tube from the bladder to the outside. And in men, this goes through the penis and is 5 times longer than the woman's urethra. So women are much more likely to get urinary tract infections because the urethra is short. Urethra is a tube to the outside of the body. Anything to the outside, things can crawl up. And so little bacteria and other little lovely little microbes can get into the urethra and crawl up into the bladder and cause urinary tract infections or bladder infections, or worse, move up to the kidneys. So that if the urine is acidic, that would actually be good because it'll kill some of those bugs. Remember, acids denature proteins or make them unfold, right? And then they don't work. And so if we can denature the proteins in bacteria, we can kill them. Okay, so there's the bladder. Now the urethra,
Clitoris.
if I can show
Pelvic
that.
bone.
Let me get rid of the coxal bones. So I'm going to get rid of
Pelvic
her
bone.
hip bones. Okay.
Urethra.
There's the urethra. Let's make it about red. Can you see that if I make it red? I'll blow this up a little bit. Again, fairly short in a woman, and I can show you male reproductive parts here in a second. We'll go to a different cadaver. But the urethra, the hole to the outside, or the orifice, is anterior to the vaginal opening, which is pretty important when you learn how to catheterize somebody, because putting a catheter up the vagina isn't going to get you any urine, right? So you need to know where that is in a female, so when you catheterize them, you know what you're doing. Okay. Everybody okay so far? Really, there's only 4 parts for the urinary system: the kidneys, 2 of them, 2 ureters, the bladder, and the urethra. Okay, now, the functional part of the urinary system is the nephron. The nephron is the functional unit of the kidneys. You have about 1 million of them in each kidney, and that's what's going to form urine. And you'll see that in the notes when you go through the urine formation stuff. And that would all be microscopic. You can't see that on a cadaver. At this view, you would need a microscope to see those parts. But there's lots of diagrams in your lab books and in your textbooks of the nephron. Okay, so while we're here, you can see the bladder is in yellow. The
Broad
uterus is on top of the bladder. And I'm going to take away the ligaments that hold that
Broad ligament.
so that you can
Uterus.
see the uterus. And if I color the uterus, let's see, what would be a good contrasting color? Red's not as good as I would like it to be. How about blue? Can you guys see the uterus there a little bit? The uterus is on top of the bladder, and during the first couple of weeks, first trimester of pregnancy, it is also on top of the uterus, but the developing child is pretty small. It actually tips back a little during the second trimester. However, by the time you're getting towards, 5, 6, 7 months pregnant, the baby gets so big that it's pressing on the bladder all the time, and little kids using it as a trampoline and just jumping on it all the time or pressing on it, which makes it so the woman feels like she's got to pee all the time, which is why pregnant women have that lovely side effect. But you can see why. It's sitting right on top of the uterus. All right, so here is her ovary. And if I color her ovary white and the fallopian tube, I color it purple, okay, it looks like they're attached. See the white here? The purple looks like it's kind of like a cap on top of that white area. It actually isn't physically touching. The fallopian tube or uterine tube, the end that touches the ovary is called the infundibulum, and there's fimbriae. It's kind of like if you make a fist with one hand and put your fingers over top of your other hand and wiggle those fingers, those fimbriae reach down towards the fist but never touch your fist. So the ovary is your fist, and the fimbriae are moving in time with the woman's beat of her heart. And when her heart beats, it kind of pulls up. The fingers pull up. And so when a secondary oocyte is released from the ovary, it kind of gets sucked into the fallopian tube. So it looks like they're touching, but it actually isn't physically touching inside the body. So the egg is released, or secondary oocyte more correctly, and it pulls up into the fallopian tube and starts to travel down towards the uterus. So you're in this purple tube and you're traveling down, if you were that secondary oocyte, towards the uterus. Sperm fertilize the egg or the secondary oocyte in the fallopian tube, in the uterine tube. That's where fertilization takes place. And the egg will only survive about 24 hours, so you got to have sperm there within 24 hours or that secondary oocyte is not viable anymore. Then it takes about 5-6 days for that fertilized egg, the zygote, which is then called a morula and then a blastocyst, to get to the uterus. And that's where it has to implant. And implantation is actually pretty difficult. Only 3 out of 5, or 2 out of 5, 3 out of 5 don't implant properly. But if implantation doesn't happen correctly, you don't get a placenta and an umbilical cord, and you're not going to be able to nourish that growing fetus. Anyway, you don't want the attachment to happen in the fallopian tube. That's an ectopic pregnancy. So you need to get it to the uterus, it needs to attach, and that is a difficult process, and you need it to work correctly in order for that embryo to develop into a baby. Okay, so now you're to the uterus, and I'm going to take away the bladder and the urethra. And now you have leaving the uterus and it goes to the vagina, but between the two of them is the cervix. The cervix is a rigid structure that is pretty tightly closed. It prevents the baby from falling out of mom, if you want to think of it that way. But also, during sex, for example, or intercourse, more correctly, sperm are deposited at the base of the cervix. The penis could not go through the cervix. It is protective because the vagina, again, like the urethra, is an entrance to the outside, and it can have bacteria and yeast and other, microbes that are fairly dangerous. You don't want to move up any further into the uterus. You cause uterine infections and other problems. So the cervix is protective. It really only opens to allow for a baby to come out, and a baby, on average, takes 5 to 8 hours to cause the cervix to dilate large enough for a baby to come out. They literally use their head kind of as a battering ram to push against the cervix to open it, which if you've had a child, you probably know, and it's not particularly comfortable. Anyway, the vagina or birth canal then leads to the outside of the body, and you can see
Labia
the
majora.
labia here, labia majora
Labia
and
minora.
minora. It is similar to the scrotum in the male, a little bit protective. There's some fat there, but it's the opening, the outside opening, sometimes called the vulva in other animals, leads up into the vagina.
Dorsal artery. Clitoris.
This right
Clitoris.
here is the clitoris. I color that white. Nerve endings are there. It's very similar to the glans penis in the male, but it is not necessarily the G spot. There is no real G spot in a woman. It differs from person to person, but they will sometimes, if you have transgender surgery, use the clitoris to make a small penis so that you're not going to pee through it because they can't move the urethra in it like it would be for a man, but they can use the labia to make a scrotum, use the clitoris to make a small penis, and you can actually look like you have male parts if you wanted a sex change operation. Okay, so you have ovary, fallopian tube, uterus. In AMP2, you will learn about the endometrium and myometrium. Endometrium is the inner lining of the uterus, and the myometrium is the muscle wall of the uterus. Then you will learn about the cervix, vagina, labia, and clitoris. I think those are all the female reproductive parts that you need to know. Okay, so that was kind of really fast. Then I did respiratory, urinary, and reproduction. I'm going to get a male cadaver up to show you male reproductive parts, but it's probably going to take a minute or two. So if you have any questions, you can put them in chat or shout them out right now while we get a male cadaver up.
So when we're taking notes for these, where would we submit them?
If you attend, you don't have to take notes or anything. You just get points for being here.
Oh, okay.
Yep, you get 10 points if you show up. If you can't make them, because I know they're at different times, then open up whatever recording, listen, watch it, and you write a summary and you can submit it right there.
Okay, thank you.
Yeah, so you have to come, if you're an AMP2, you need to do 2 of these over the semester. If you're an AMP1, between the case histories and the virtual cadaver recordings in my class, you need to do 6. And one of them has to be a virtual cadaver session. I don't know what Ryan's class, if he's requiring these or if they're extra credit, so you'll have to ask him. All of them, Zach asked, they are recorded, And I've posted the recordings down at the bottom I think there's a module down at the bottom about the virtual cadaver recordings. And this one is being recorded, and I have to process it and then upload it to YouTube because YouTube is the easiest way for students to get to it without getting screwed up with the technology. So I will get this one, the one I did Monday, and this one I can do it tomorrow. My home computer actually works better than the work computer because I have more memory on that one to do that. So yes, they will be they're recorded, and I post the recordings. If you're in a different class and you want the recordings, let me know. I'll send them to Ryan. Catherine, you asked, for the urinary system, the main parts that we need to know are the anatomy of it and then basically how urine is made. There is more about the physiology. There's a lot about water balance, electrolytes, acids, and bases. That's the second module, or the second part of the urinary system. There's not a ton of anatomy. There's literally kidneys, ureter, bladder, and urethra. The nephron, you will have to know the anatomy of the nephron. There's a picture in your lab manual. There's a whole bunch of pictures in the PowerPoints, but you will have, those will be multiple choice. You will not have to memorize the parts and identify them on the lab test for the nephron. And for Biology 105 students, you do not have to memorize the parts of the nephron. You simply need to know that that's the functional unit that makes the urine. Making urine, for Danielle, you asked a question about the AMP2. If you write a summary for one of them, it counts for both classes if you're in both of them. Yes, all the recordings are the same. All of the virtual cadaver sessions are open to all my AMP1 and 2 students and Ryan students this summer. Okay, urine formation, that is in your PowerPoint notes. Basically, there's 3 steps: glomerular filtration, tubular reabsorption, and tubular secretion. The key thing to remember is if you go through step 1, you end up in the toilet. If you go through step 1 and 2, you end up back in the blood. You save it. If you end up going through step 3, you end up in the toilet. That is literally the easiest way to remember those things. Okay, so if you know something ended up in the toilet, like potassium, it had to go through step 1, 2, and 3, or at least just 1. How many sessions do you have to come to for AMP2? 2 of them. You have to do 2 over the semester. Or you can write summaries for sessions that have already happened, and the recordings are up. Okay, so this guy is cadaver number 3. He's the one with the awesome muscles. If you look at this picture, this one, do you guys know what the muscle is in white? You know what muscle that is, anybody?
Pectoralis major.
Pectoralis major, good job. The blue one is your deltoids. The yellow in the upper arm here is your bicep. The red one is your triceps. The green one in the neck is the sternocleidomastoid. The one around your lips is orbicularis oris. These pictures are, here's one that's with labels, but these pictures are available in PowerPoint for the AMP1 students, and I believe also for 105. Anyway, this is a good way to learn muscles. This particular cadaver is so wonderful because he's got such good muscles. He was probably working out literally the day the day before he died. All right, so we have them down to the superficial muscles, or the most superficial. You can take them down a little bit lower to see the more deep muscles. So now we're down to the internal oblique, for example. take off a little bit more, we can see his intestinal system, rib cage. Okay, if we take away his guts, just like we did with the female, now you're down. Again, you can see the kidneys, the ureter, the bladder, and we are I'm going to take away, he is not in anatomical position. You can see his hands are really in the way to see urinary and reproduction. So I'm going to take away his lower arms anyway, which is going to look weird, but it's way easier to, excellent, we can leave the upper ones. We're going to, there we go. We're going to take away his arms, which looks funny, but they're kind of in the way to see. All right, so you can see his kidney. You can see the ureter. Again, is the tube that goes down to the bladder. If I color that white, you can see his bladder there. Color that white. Color
inferior
this
vesical
ureter.
vein. Inferior mesenteric vein. Colic vein.
See if I can hit ureter here.
Ureter.
There we go. Okay, so down to the bladder. Now, this is a male, so there's no uterus, right? And he is missing his right testicle. However, from the bladder to the outside, the urethra carries urine and it also carries sperm. So if I take away his pubic bones, so we can see
pubis
a little bit better. Okay, notice the urethra goes through the prostate gland. The prostate gland is right beneath the bladder. The urethra is the tube. Veins. Let's see if I can get the urethra and then blow this up so you guys can see it.
Urethra.
All right, let's make that purple. All right. Hopefully you guys can see this okay. I'm going to blow this up as much as possible. Okay, the bladder's in white, the prostate is in the teal blue, and the urethra is coming out of that going into the penis. The prostate gland secretes a neutralization fluid right in front of sperm because sperm are going to be pushed into the urethra that just had urine, and urine is acidic and it would kill the sperm. So to neutralize the walls and that region where sperm is about to flow, the prostate gland secretes a fluid. So does the seminal vesicles.
Ductus efferens.
And the seminal vesicles, I'm going to color the ductus deferens purple as well. Maybe I should use a different color. Let's use blue. But the seminal vesicles, I don't know if I can, oh my gosh, what did I do? I turned him over. If I turn this over on the back side, the seminal vesicles are also secreting a neutralization fluid. I'm going to color those red. So the sperm come up from the testes, and we'll talk about that in a second. But right before the sperm move into the urethra, the seminal vesicles and the prostate gland secrete fluids. Neutralization, there's some prostaglandins, some vitamin C, there's fructose, which is a sugar that is going to help power the sperm because the sperm are going to have to be motile once they're in the female. The sperm do not swim out of a guy. They're shot out during ejaculation. Okay, so if the prostate gland swells up like it does in older men, if you live long enough, you'll probably have an inflamed prostate or prostate cancer. Sorry, guys. You can see how it would squeeze the urethra. So your bladder's full, it's saying, I gotta pee, but your prostate gland is swollen and squeezing the urethra, you can't pee, which is a common thing in older men. They're like, I have to go, I feel like I gotta go, but nothing comes out. And it can be due to a swollen prostate. Now, think about where the prostate is. It's underneath the bladder, behind a whole bunch of bones, which we removed. So it's really actually kind of hard to get to. It's major surgery to take out your prostate gland. And they used to do it more commonly, but now there's other treatments, medications. They're not just taking anybody's prostate because it's hard to do, and it can cause some side effects for men that aren't too pleasant. All right, let's go down and start where sperm are made,
Testis.
and that would be the testes. He only has one, so we're going to show you the left one. Sperm are made inside the testes or the testicle in seminiferous tubules, and it's kind of a long process of maturation. Eventually it gets into the epididymis, which is a second set of tubules. And if I make that one kind of a bright green there, you can see the epididymis. Between the seminiferous tubules and the epididymis, it's like a mile of travel or something. I mean, it's a huge number. But it takes 60 to 100 days. And as sperm are moving through there, they're getting mature. It starts out, they look like just little cells, but eventually they look like tadpoles, like we see in the movies or in the pictures. So the sperm are made in the testes and then mature through the epididymis and then travel up into the body via the vas deferens or ductus deferens. That's in purple here. And that's what's cut during a vasectomy. Okay, and it's easy to get to because it's outside the body. So a vasectomy is much, much easier than a tubal ligation in females, although they are doing it now vaginally rather than going through the body wall. Anyway, travels up the vas deferens, comes around, and it comes in front, but you can see the top here where the purple loops are, and it meets where the seminal vesicles secrete a fluid, prostate secrete. And now, let's put this guy back to normal here. Okay, I'm going to blow him up again. So I'm going to show you the front. The sperm are now being in the urethra, and the prostate gland and seminal vesicles have secreted a fluid, and it's going to get into the penis.
Corpus cavernosa,
Now,
penis.
the penis has spongy tissue called the corpus cavernosum and the corpus spongiosum. Basically, more blood goes in than can come out. So if more water goes into your sink than can drain, your sink is going to overflow, or if it was a tank, it's going to bulge and or expand, and that's what an erection is. More blood in than blood can leave. It's not a muscle contraction. Muscle contraction's used in the act of sex, but not for ejaculation or an erection. That is more blood in the penis. It's holding more blood because the veins are constrict and the arteries dilate because of activation of the parasympathetic nervous system. And that corpus cavernosum and spongiosum basically fill with blood. Okay, and taking Viagra helps that happen, but you should not take more. 1 is good, 2 is not better, because if vasodilation doesn't reverse and you keep an erection, that can eventually run out of oxygen and that tissue is going to die, and nobody wants that to happen. And the way to fix it is you go into the hospital or ER, and they take a big old needle and suck the blood out. So that's not comfortable either. Now, if I take away the corpus cavernosum and the
Superficial,
corpus
external pudendal
spongiosum,
vein. Corpus cavernosa, penis.
you can see,
Corpus spongiosum, penis.
okay, here's the urethra. Okay, we're down to
Spongy.
just the urethra. Let's make that purple so you can see it. Okay, to the end.
Glans,
the end
penis.
of the penis is called the glans penis. Again, like the clitoris, where all the nerve endings are. That's why it hurts so much when a guy gets injured there or kicked or something happens. Okay, and that is gonna, the urethra is going to carry the sperm or ejaculate the sperm out. Okay. So there you go. The glans penis, the corpus cavernosum and spongiosum, the tissue inside, the urethra, prostate gland, seminal vesicles, ductus deferens, testes, and epididymis. And the testes on the outside of the body are held in a sac called the scrotum. That's also on the or on the magic list that you need to know for the anatomy. Any questions? Now's your chance. You can write it in chat. People have asked me all kinds of stuff. Like, somebody asked me once, how population? Apparently it's 28 miles an hour, and I have no idea how they measured that. You need 100 million sperm per milliliter to be considered fertile if you're a guy. And you have 2 to 3 mils of semen per ejaculate. So that's 2 to 300 million minimum in order to have a good odds of one of them reaching that secondary oocyte. Which is kind of amazing. Any other questions?